Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have a very renowned neurologist, Dr. Kishore KV. He is a very highly accomplished person and also an expert in epilepsy. He is a gold medalist from the university and he has had an advanced training from NIMHANS. Apart from that, he has got MRCP from United Kingdom and he has developed his own comprehensive way of treating the epilepsy. More than that, he's more interested in bringing awareness among the people so that they can come to the neurologist in time and prevent the diseases or get the treatment in time. And in that direction, today he is here to tell us about the dementia. Welcome, Dr. Kishore.
Thank you. Thank you.
You know, everyone, right from childhood to the old age, they keep on forgetting. Is forgetting natural or is it a disease? And when do you call it as a disease?
Yeah. So, memory loss is a rule. So, memories are infinite. The storage of memories is very finite. So, in our brain, we have limited space to store memories. So, for Google Drive, we can pay extra and increase the storage, but in our brain, we can't increase. So, what brain does is it will only keep what is relevant and throw away what is not required. So that is why memory loss is a rule. We only keep few memories inside our brain for long-term functioning of ourselves. So that is for everybody. But for few people, they may have more memory reserves. But overall, this is the dictum that
Because Swami
most of the
Vivekananda had a very good memory. Whole book he could recite after reading. But nowadays the children they read now and they forget, and by the time they go to examination hall, they are totally blank. So that is not a disease, you mean?
no, no, definitely not. So all of us forget. Only thing is what type of memories are kept for permanently stored is when it has an emotional significance, when you have seen it with your own eyes, which can happen, and also if you are interested and if you're excited about things. For example, you didn't know something, you want to know how it works, and you make an effort, you see many videos, you read about it in books, and you try to analyze that, memories will stay for a long time rather than the garden variety of just mugging up and trying to reproduce.
Okay, okay. When you said mugging up, I remember our Rishi Munis, for thousands of years, all the four Vedas they memorized and they used to chant, and that's how they kept because there was no paper to write then. There was no computer then, but the brain was like a computer. So brain has got 8 to 9 billion brain cells, and the memory can be improved or it can be decreased. So what exactly is this dementia? And what are the causes for the dementia?
Yeah. So, memory is just one part of intelligence or the
Hmm.
function of the brain. We have planning, we have problem solving, we have calculation, we have visuospatial. That is, how am I related to this space? And from going to one place to another, how to go.
The
So, and
surroundings, yes.
memory,
Hmm. Hmm.
yeah, and working memory, and all those things are there. So, in this many domains, we call it as domain in cognitive neurology. Memory is one of the domain. So in case if there is any two or more domains involved, and it is so severe that it is affecting the individual's day-to-day activity, personal, social, or work related things,
Hmm.
then
Hmm.
we brand it as dementia.
Okay. Sometimes, the doctors, when we go with the memory loss or something, we are forgetting often. They say it is MCI. What is that MCI?
Yeah, MCI is minimal cognitive impairment. So, the normal intelligence to dementia is a spectrum, and MCI comes in the middle, bang on the
Middle.
middle. Yes,
Okay.
they are not fully
Like
normal.
sitting on the fence.
Pens, pens,
Hmm.
exactly.
Hmm.
So they are not fully normal, but they are not fully dementia. They are able to
Hmm.
carry out their activities like normally,
Day-to-day
but
life. Yes.
yes, but there are some suggestions that they are having some difficulties.
Hmm. Hmm. So, what happens to them?
Yeah,
Will they
so very
develop
important.
dementia or not? Hmm.
So very important point here is I become very detailed assessment in MCI because many of them goes back to normalcy. Many of them, that is one third goes back to normal, one third continues as MCI, and one third can travel to dementia spectrum. So we need to do detailed assessment for the MCI people and check for any reversible causes, nutritional, medication related, mood related, other medical or surgical related things, and immune related changes. If there is anything, we may have to correct it so that to pull them back to the normalcy.
Okay. Oh, and what are the types of dementia? And how do you differentiate and how do you treat them?
Yeah. So there are many types of dementia. In dementia, the most common dementia, which is famous, which everybody knows, is Alzheimer's dementia.
Alzheimer's disease.
So
Yes.
yes. So here, the most commonly they have memory, predominantly memory involvement. That's why they keep asking same questions again and again. So why this? They ask same questions again and again, not because they've forgotten the answer, but they've forgotten that they've asked the question. So that's why they ask it repeatedly. So
Okay.
they present to us late because they are otherwise harmless. It is considered as an age-related changes. Second
Mm,
one is frontotemporal dementia. They come early because they have lot of behavioral changes. And
mm,
there is something called as rapidly progressive dementia where they are absolutely normal few weeks or months back and now they behave like small children. So that will be their cognitive status. So they present very early. Lewy body dementia, and there is something called as normal pressure hydrocephalus, where they have
mm.
some memory issues, but that is a reversible. Surgically, it can be changed and it can be
Corrected.
reversed.
Corrected. Corrected.
Corrected. Yes, yes, yes. So these are the many types of dementia. First thing is
Mm,
we'll evaluate if there is any reversible causes. If
mm,
there is reversible causes, treat them and bring them back to normalcy. If not, start them on cognitive retraining to use all the networks of the brain
mm,
so that they become functionally independent. And
mm,
certain places use medications also to manage them. So
mm,
recently, two new molecules has been launched for Alzheimer's dementia. Not for everybody, but there are specific criteria. So we
mm,
assess them, and if they are suiting, if they are
mm,
eligible, we try to recommend them that also.
mm. And recently, it has been shown that those who are obese, they develop Alzheimer's disease along with the diabetes, high blood pressure, and high cholesterol, and all that. And what are the do's and the don'ts that you have to tell? Whether it is a food or their habits, what exactly do you advise the people to prevent this dementia?
Yeah. So basically, dementia, like any other disease, is a dance between genetic and environment.
Hmm,
So the risk factor, the vascular risk factors, that is diabetes, hypertension, and metabolic syndrome,
hmm,
all holds good to dementia also. And
hmm,
if we keep them optimized, and we can prevent the
hmm.
part it plays in dementia or memory loss or cognitive decline also, and
Okay.
keep the brain and body active and
Very
keep
alert and
learning.
active and full of life. Be
Yes,
energetic and then live your life fully. Yes,
correct. And also learn new things, whether it is a
yes,
physical skill or mental skill. Keep learning new things so that there is something to look forward. So that is
yeah.
the way to postpone or not to have dementia.
Okay. Like a child, you must have curiosity, interest, and then take active part and participate. and then enjoy life. And that's the way to keep the dementia away. See, my grandfather and father, they lived for 93, 95 years. Still, if the last day their mind was so clear. But I see many people, like absent-minded professors. Though I'm a professor, of course, I don't forget. But there are people, who keep on forgetting. And probably I feel that when they lose the interest in life and then, they are more mentally depressed or stressed and they are likely to forget the things and get into the trap. So thank you very much, Dr. Kishore, for advising so well. And we welcome the viewers if they have any questions, any doubts, or any problems, please ask, and Dr. Kishore will answer your questions, and you can get your mind cleared so that you don't have any doubts. So thank you, Dr. Kishore.
Thank you, ma'am. Thank you for
It's
the
a
invitation.
pleasure talking to you. Thank you.
Thank you. Same here.